So welcome all to the Midlands Maternity and Midwifery Festival 2019. As Sue said, I'm Jasmine Cajee. I'm a midwife, clinical background. I'm still working clinically 2 days a week as a community midwife. And for the last year, I've been working with the Leicester City Clinical Commissioning Group, trying to implement the Better Births Transformation Plan locally for LLR, and my role is as a midwife program support officer to try and help implement all the facets of Better Births locally. So on the front there, I'd just like to introduce yourselves to, we've got Tony and Peter. That's our MVP user and his little boy. We've got one male on our group, and he's brilliant. And they come to all our meetings. So not very many MVPs have men on them. We've got midwifery's majority women, but this is one of our users who's passionate about maternity services and wants to make a change. So how Llr MVP was introduced. We have the Better Births Transformation Plan, and the Better Births Transformation Plan recommendation is for each LMS to have a Maternity Voices partnership. Locally, we already had an established Maternity Services Liaison Committee. This is made up of professionals, so it's providers, commissioners, we have public health attendants, we have healthcare professionals from a wider arena, such as children's centres, smoking cessation, breastfeeding specialists, and some users that attend. However, our user attendance is limited within our MSLC because we seem to use this more as a conduit for our pathway work. And so we found joining our maternity voices with our MSLC wouldn't be a positive because we probably wouldn't get many users through the door, as it is quite professionals heavy as such. So this is why we recognise that it would be better to have a separate arena for our women and families and have a separate MVP so that their voices are heard. So the aims of an MVP for a Maternity Voices partnership, the aim is to meet the recommendations of Better Births. There's been a recognition at a national level that an MVP is the best way of instituting service users and using co-production to improve our maternity services and shape the future of our maternity services. It's a forum for our service users to try and chair, manage and do this voluntary with our assistants and have that say and lead on the care of our future of maternity services. And also it's an opportunity for them to be able to have their say, even if it's a whisper. We find when you're in an arena where you've got lots of healthcare professionals, women and families may not speak up, they may feel a bit intimidated, and an MVP is away from that, especially our MVP I know is away from that, so we don't have a lot of healthcare professionals, and the main reason being is these women can feel open to having these conversations and bringing up their concerns. And also promoting our services and coming back with positives, because we do get positives, it's not always negative. So the benefits of an MVP are, as I said, it creates a co-production forum for maternity service users and also the healthcare professionals involved, because it gives us what is required out there. It gives us an understanding of how we need to implement services and care to meet these individuals' needs. And the core 5 principles of that is that it gives us an opportunity to work creatively, respectively, collaboratively, and co-produce solutions together, keep them involved, work together as equals, there's no hierarchy, and allow them to have their voices heard, and obviously enable our diverse communities as well to have a voice, especially in LLR. We've got quite a mixed, diverse community, and we need to be able to bring these women's voices to the table and obviously take their options forward of what they require. And obviously it's something that will bridge the gaps as well. So we've had quite a lot go on in our journey so far locally. As I said, I commenced my role last year, February 2018, We're a year in. We were tasked to establish and launch an MVP locally, and that was my first role when I came into post. And I thought, I've never done anything like this. I've always been a community midwife, hospital midwife, worked the two together. How do I take this forward? So I did a lot of contacting. I spoke to other areas with successful MVPs. I engaged with our patient partners. And I've had some brilliant support from them, as well as guidance in trying to establish our MVP. And I engaged with other areas, as I said, but also I extensively reviewed the toolkits on the National Maternity Voices website. And I attended a Better Births 2 Years On event last year in March 2018. I was very new in post, and there was the National Maternity Voices Partnership that had a stall, and there was a lady from Barnsley MVP, and I approached her and said, I'm just looking to set this up, and she was brilliant help. She came back to me, assisted me in what we needed to do, how we needed to do it, and she gave me a bit of confidence, because she said, even if you've got 2 people coming to your MVP once every so many months, it's something. You've got a voice there, and you can take that forward. So I think that was brilliant, being able to tag on to somebody that is actually doing it, and they've got a successful MVP in Barnsley. And so she was able to give me lots of hints and tips, and I was able to bounce off her to say, I've done this, I'm not quite sure whether it's worked, try this, try that, and eventually we got there. So we attended a regional event to meet other MVPs within our region. It was an opportunity again to share best practice. We've attended 2 so far. So the very first one was in April 2018. Our MVP wasn't launched at that point. We were still looking to set ours up. In fact, we were looking at introducing our leaflets and getting set up and having a launch date. Going to this event was very helpful, because it, again, was an opportunity to meet other regions within other areas within our region and find out how they've done. Some people have used Healthwatch, some people have gone off and done it themselves, how they've done it, what they've needed, has there been any financial issues. It was really good, and I've gone back since to a November event last year with Tony and Peter. And I must say, we have been recognised as a region to have a good MVP. We've made lots of success. We're not a year in yet, and it's working for us. We developed and devised a local leaflet to advertise our Maternity Voices partnership, and this was devised by myself initially, and then I had somebody from the comms and engagement team within the Leicester City CCG have a look at it, because obviously it's got to be user-friendly and not a lot of jargon in there, so people are happy to understand it and read it. And then we've gone on to have that successfully printed, and it goes out electronically now as well, which is a good thing. We have linked with University Hospitals of Leicester for them to have on their Facebook pages. There's information on the UHL Maternity Services site, so there is a handle for Better Births, and within there is an area for MVP, and my details are on there. And I must say, I think some of the users that I have got have come through that arena, so they've gone onto the UHL Maternity Services site, thought, I don't know what a Maternity Voices is about, let me contact her. Some have stayed, some have said, actually, it's not what I was thinking it was. And that's fair enough, but it's a nice way of getting contact from our users. We developed a frequently asked questions, because the terms of reference, if you've been on the Maternity Voices Partnership website, the national site, I think the terms of reference is a long process, it's a long paperwork, long document, which is about 4 pages, I think. And if you are wanting to join something, it's a case of, do you have the time to read through something that's 4 pages that has quite a lot of high-level kind of needs to read it effectively and understand what it involves? You might get through the first page and think, no, I don't know, I don't understand this. So we actually had one of our patient partners who looked at it and said, Jasmine, I don't think anybody's going to read this. So I said, what do you suggest? And she said, well, can we do it as an MVP 1-pager? And so I said, there you go, there's the terms of reference, off you go and have a look, come back with it and let me know what you think. And she dwindled it down to 1 page, so it's our MVP 1-pager, which comes around with us now, and it's pretty much the terms of reference condensed down. And since we've now launched our MVP, and our users have actually looked at this collectively and confirmed that they're happy that the terms of reference and this marry up together, and what is in the MVP 1-pager is actually a succinct version of the terms of reference. Llr Better Births, as I said, planned and delivered and launched an event in June 2018 for our MVP. Our launch event was open to the public. We advertised it via the internet, via Healthwatch, via children's centres, as many arenas as we could. It was open to the public, but it was also an opportunity for service users to come and engage with healthcare professionals, because we had healthcare professionals there. So we had the home birth team, we had St Mary's Birth Centre, we had Stop Smoking Cessation there, we had the Leicestershire Partnership Trust there that attended from a health visiting perspective. It was a brilliant day for staff to network, but also for users to get this opportunity to meet healthcare professionals. And at this event, we had attendance from the National Maternity Voices Partnership. And I must say, I don't think this happens often, but we did manage to get this. And it was Emma Crooks who came from a national perspective, but also from her Barnsley MVP hat, and came and supported me on the day. We have identified a chair. We've got Rupal Shah. I don't know if she's in the room. I know she's here. She's on the SANS bereavement table as such, but she is our chair for our Maternity Voices Partnership, and I support her as best as I can. We advertised, as I said, our maternity services website. We advertised our MVP on there, on the Facebook page, through our leaflets. I don't know if some of you have been around the stalls, but we've got some leaflets out and about. They're in children's centres, they're in GP surgeries, they're within the trust, so women are able to access them when they come into antenatal clinic area. And we've also started putting them out through the postnatal wards, so when they've delivered and they're being discharged, the units have got sufficient supply to be able to put them in the discharge pack so women can have them. And if they feel they need to speak to me or refer themselves and be part of our MVP, they can. We hold bi-monthly meetings in children's centres. This is what's been requested by our users. They wanted to have these meetings quite frequently. On the national site, the recommendation is 4 meetings annually. But the users want to meet every other month, and that's keeping them engaged, so that's what we're going with. Obviously, the national site is a guidance, and I would say you plan your MVPs according to what suits your individual areas and needs. So far we've discussed several aspects in our MVP. We had personalisation as one of them. NHS England asked us to take through a definition for personalisation and go back to them with our said definition for better births as to what we would do for personalisation. And I took to the MVP 3 different definitions. They looked at them and came back with one, and the consensus was they were happy with that. So that has gone off to NHS England, and it has actually come back with a lot of positive feedback to say it was a brilliant definition, it's quite concise, it's not airy-fairy, it is actually what we plan on doing. We've also discussed options such as choice, continuity, excuse me, partners staying on the wards. We've recently had partners staying on the wards, and we've taken that through our MVP. Again, a mixed bag of yes and no. Some prefer it, some don't. We've also discussed the bereavement pathway with regards to the SANS teardrop sticker. And I must say it's been a long journey. We started that probably one of our first agendas. It came up. That was last year, August. And we're now in the process of going through governance, and eventually, hopefully, we'll have a pathway for our SANS teardrop sticker to go onto the bereavement pathway, so that women are given that option to use that sticker if they wish to. And we're also looking at the induction of labour process and what information women are given. Again, this has come through our MVP. So we're now on the National Maternity Voices page, as I said. Our present chair is Rupal, but she's supported by the PMO, so by myself. We've attended the regional events. Thank you. We've attended the regional events. We've got very good engagement from our head of midwifery. I can go to her once I've had these meetings, and if something comes up, and actually feed it back and see that things will move forward. We've also had Healthwatch Engagement from the start. So although we've not commissioned Healthwatch to roll out our MVP, they've been very engaged from the minute go. We have a representative that comes to all our meetings, and they take things back again to their arena as well, and has good engagement and feedback when she is at our meetings. We've recently had engagement from Perinatal Mental Health. They're doing a lot of work around perinatal mental health locally, and also it's a national ask with regards to better births. And we found, instead of having professionals that are trying to have user engagement, having lots of different meetings and expecting our users to attend lots of different meetings, it makes more sense that if we've got one meeting, we have the healthcare professionals that are involved, that want to be involved, not to bombard the meetings, but probably to come in at a professional level and take their pathways through our MVP. And it was quite productive. They came to the last meeting. The users were very happy to have a discussion and would be happy for them to come back. Also, Public Health have attended our meetings, and we've actually got a graduate officer working with Public Health that has been supported and commissioned through the Better Births, and engaging with users to find out what information is given to them, and the information that is given to them, what aspects are consistent, are they happy with how it's given, when it's given, what format it's given, and so that we can look to improve the information that we give out to our women and families in the near future. And obviously I've had an opportunity to share our success here today. So we have planned a team building day. It's been commissioned through the CCG, and we've commissioned Healthwatch to take this day forward for us. It's a way of us thanking our users, to show our appreciation, basically. You know, they come in out of their own time. They come along with their little ones. Sometimes they're coming in on days off if they've gone back to work. So it's for us to give them something back as a way of thank you. And also an opportunity, because I've got 18 users on the MVP at the moment, but they don't always attend the meetings. Sometimes I've got 5, 6 women that attend the meetings, sometimes 7, including Tony, but they don't always attend. And so the wider 18 users can sometimes communicate with me via a virtual route of emails. And we've set up a WhatsApp group, and Tony's looking to set up a Facebook group, but they don't always meet in one room. So some of our users don't know each other, and it would be good to have a team building day so they can actually network, connect with each other, get to know what backgrounds they're from, and obviously just celebrate the success that we've had, make them feel valued. And I think that's, in a nutshell, in summary, basically, that is our MVP. So we're using myself as a conduit, working between the trust and the maternity voices and the commissioning group. So when I go into these meetings, I do have my MVP hat on. Sometimes I've got my commissioning hat on, sometimes it's my midwife hat on, and sometimes it's just a parent. You know, my boys are older, they're 15 and 14, but I did go through the maternity services locally, and I can relate to it to a certain extent. But the main thing is an opportunity for service users to also meet other parents. When you've had a baby, sometimes you are cooped up at home, sometimes you don't go out, you know, you don't see other people apart from your children, your partner, possibly your parents. And this is you know, an opportunity for them to come along, network, build relationships. They might go away from here and go to another children's centre and have a stay and play with each other. They may go to a baby massage. So it's an opportunity to give some of our users something back. What I would recommend, if there is anybody from another area that's looking to set up their MVPs, we'd recommend that you review other MVPs within your region, find out what's available out there, what people have done, and if they've been successful, gain support and guidance from them, and enable the team to have their own MVP, build their own MVP. So obviously, if you're trying to help them set it up, don't rule it. Let them take, reign of it. Let them set it up. When do you want your meetings? Where do you want your meetings? What do you want on the agenda? How can I facilitate it? And that will empower them to make that MVP successful, I think. And that's it. Thank you very much. Any questions? Thank you. Thank you.
No, don't run away.
No? No, not run away.
No, you can't run away. So we have a few little time for questions. We have a roving mic because Jasmine's given us a lot of information. It's like a new language, all of this. MVPs.
I had to learn it.
We'll all get
very
used
quickly.
to it, I guess. Elsie at the front's got a question. I won't take it away.
Okay, thank you.
Thank you. That was really, really informative.
Thank you.
So I've been involved just recently with an MVP. And what I don't understand, and perhaps you'll be able to explain to me, is how is working at that level influencing what happens at the interface between the clinician and the patient or the woman, the user of the service? How is that MVP that's created influencing
So
the
if you
patient?
look at it in the sense that if something was raised within the MVP, that was quite a valid point and needed to go back at staff levels, and the user needed to make sure that, yes, that's happened and we need to see that it's been successful. For myself locally, I'm acting as that conduit. So I go to the MVP meetings. I don't chair them. Rupal seems to chair them. I sit there very quietly, take my minutes. I don't ask for admin support to come for the minutes because I feel it a bit daunting for the women. But me and Rupal take minutes together. We'll meet up, confer our minutes, make sure we've put them through on a formal formal recording of our minutes. And then what actions there are, we take them away. And if there's something that she can go and action, like the Sans teardrop sticker, she went and ran with that. If there's something I can action, I take that back. If it's something I can't action, I'll take it back to the trust and find out who it is. And I act as that conduit. And then within the meetings, when we come back to the next meeting, we do review the agenda and the minutes from the previous meeting and feedback to say, so far we've made this progress with this item, or actually we've not had an update yet, but it'll come back on the next meeting. And then obviously I assume it's a case of, we've not been in more than a year. June will be our first birthday as an MVP. But I feel like once we've done something successfully, I can use the teardrop sticker. Eventually, when it is going through its successes and we've implemented it, there will be some communication to the staff to make sure that they follow it through, because that's key.